Here's something that surprises many people. Erectile dysfunction can sometimes be one of the earliest warning signs of heart problems. Long before a heart attack or serious heart disease appears, the body may quietly send signals, and one of the first places those signals show up is in a man's ability to get or maintain an erection. Most men never connect these two things. They treat erectile dysfunction as an embarrassing issue or a private frustration. They may hide it, ignore it, or try quick fixes without understanding what their body is actually trying to say. But the truth is powerful. Your heart health and your sexual health are deeply connected. When the heart struggles, blood flow suffers. And when blood flow suffers, erections become difficult. This is not just a theory. Doctors around the world have been studying this connection for years. Many now consider erectile dysfunction a possible early indicator of cardiovascular disease. In simple words, the same blood vessels that feed the heart also play a crucial role in erections. If those blood vessels begin to narrow or become damaged, the effects can appear in the bedroom years before they appear anywhere else. Think about how an erection works. When a man becomes aroused, the brain sends signals that increase blood flow to the penis. The blood vessels relax and widen, allowing blood to rush in and create firmness. It sounds simple, but it requires a healthy cardiovascular system. Strong blood circulation, flexible arteries, and proper heart function are all essential. Now imagine what happens if the arteries begin to clog with plaque, if cholesterol builds up, if blood pressure damages the vessel walls, or if the heart struggles to pump efficiently. The blood simply cannot flow the way it should. And because the penile arteries are smaller than the arteries around the heart, they often show problems first. This means erectile dysfunction can sometimes appear 3 to 5 years before a man develops serious heart disease symptoms. That is why many cardiologists now see ED as a possible early alarm bell. It's the body's way of saying something deeper may be happening. For many men, this realization is shocking. They might think erectile dysfunction is only about aging, hormones, or stress. And while those things can certainly play a role, heart health is often a major factor that cannot be ignored. Let's talk about why this connection exists. The heart's job is to pump blood throughout the body. Every organ, every tissue, and every system depends on healthy circulation. When the heart is strong, blood flows easily through clean and flexible arteries. But when problems begin to develop, circulation becomes weaker. Conditions like high blood pressure can slowly damage blood vessel walls. Over time, this damage causes the arteries to stiffen and narrow. Cholesterol can also accumulate in the arteries, forming plaques that block normal blood flow. When this happens in the heart, it can lead to heart disease. But when it happens in smaller arteries, like those in the penis, the effects can appear much sooner. That is why erectile dysfunction sometimes acts like an early warning system for cardiovascular health. It may show up years before chest pain, shortness of breath, or other heart symptoms appear. Another factor connecting heart health and erectile dysfunction is the lining of blood vessels, called the endothelium. This thin layer controls how arteries expand and contract. When the endothelium becomes damaged due to smoking, poor diet, diabetes, or high cholesterol, the arteries cannot relax properly. Without this relaxation, blood flow becomes restricted. Restricted blood flow means weaker erections. Lifestyle choices also play a major role in both heart disease and erectile dysfunction. Smoking, for example, damages blood vessels and reduces oxygen in the bloodstream. Over time, it weakens circulation throughout the body. The same damage that increases the risk of heart attacks also affects sexual performance. Being overweight can also contribute to both conditions. Excess body fat is strongly linked to high blood pressure, diabetes, and high cholesterol. Each of these conditions places extra stress on the cardiovascular system and interferes with healthy blood flow. Diabetes is another major factor. High blood sugar levels damage nerves and blood vessels over time. This damage can reduce sensation, weaken circulation, and make erections more difficult to achieve. Stress and mental health also connect the heart and sexual function. Chronic stress increases levels of hormones like cortisol and adrenaline. These hormones can raise blood pressure and strain the heart. At the same time, stress and anxiety can interfere with sexual arousal and performance. The connection becomes even stronger as men age. As the body grows older, arteries naturally lose some flexibility. Testosterone levels may also decline gradually. These changes can combine with lifestyle factors to increase the risk of both heart disease and erectile dysfunction. However, age alone is not the real problem. Many men in their 60s and 70s still maintain strong heart health and a satisfying, intimate life. The real difference often comes down to overall health habits. Healthy lifestyle choices can dramatically reduce the risk of both heart problems and erectile dysfunction. Regular physical activity improves circulation and strengthens the heart. Exercise also helps control weight, reduce stress, and boost energy levels. A heart-healthy diet plays an equally important role. Foods rich in fruits, vegetables, whole grains, and healthy fats support strong blood vessels and stable cholesterol levels. On the other hand, diets high in processed foods, sugar, and unhealthy fats increase inflammation and artery damage. Sleep is another powerful factor that many people overlook. Poor sleep disrupts hormone levels and raises the risk of high blood pressure and heart disease. It can also reduce testosterone, which plays a role in sexual health. Alcohol consumption also affects both heart health and erectile function. Moderate drinking may not cause major problems for most people, but excessive alcohol can damage the heart, increase blood pressure, and interfere with nerve signals involved in erections. One important message men need to understand is this: erectile dysfunction is not something to be ashamed of. It is a common medical condition that affects millions of men around the world. More importantly, it can sometimes provide valuable insight into overall health. Instead of ignoring the problem, it can actually become an opportunity. When men talk to their doctors about erectile dysfunction, physicians often evaluate cardiovascular risk factors. Blood pressure, cholesterol levels, blood sugar, and heart function may all be checked. In many cases, early detection of cardiovascular issues allows men to make changes that protect their health for years to come. There are also effective treatments available for erectile dysfunction itself. Medications that improve blood flow are commonly prescribed and can be very helpful. However, doctors usually emphasize that medication alone is not the complete solution. Addressing the underlying health factors is equally important. Improving diet, exercising regularly, quitting smoking, and managing stress can significantly improve both heart health and sexual performance. These changes not only support stronger erections, but also reduce the risk of heart attacks and strokes. Some men notice improvements in erectile function within months after making healthy lifestyle changes. Better circulation, lower blood pressure, and improved energy levels can all contribute to stronger sexual health. It is also important for partners to understand this connection. Erectile dysfunction can sometimes create tension or misunderstanding in relationships. A partner may assume the issue is related to attraction or emotional distance. In reality, the cause may be physical and related to cardiovascular health. Open communication between partners can reduce anxiety and help couples work together toward solutions. Another important point is that certain medications used to treat heart disease may also influence erectile function. Some blood pressure medications, for example, can affect sexual performance. If this happens, doctors can often adjust treatments or recommend alternatives. The key message is that men should never stop heart medications without medical guidance. Heart health must always remain the top priority. Medical research continues to explore the relationship between heart health and erectile dysfunction. Studies consistently show that men with ED are more likely to develop cardiovascular disease later if the underlying causes are not addressed. This does not mean every case of erectile dysfunction signals heart disease. Sometimes the cause is psychological, hormonal, or related to other health conditions. But because the connection exists, doctors often treat ED as an opportunity to evaluate overall cardiovascular health. For many men, this knowledge can be life-changing. Instead of viewing erectile dysfunction only as a frustrating problem, it can become a powerful signal that encourages healthier living. Imagine discovering a potential heart issue years before a serious event occurs. That early warning can allow someone to improve diet, start exercising, control blood pressure, and avoid future complications. In that sense, erectile dysfunction may actually protect lives by bringing attention to hidden cardiovascular risks. The human body is incredibly interconnected. What happens in the heart affects circulation everywhere, and what affects circulation will influence sexual health. Understanding this connection helps remove stigma and encourages men to seek help when needed. Health conversations that once felt uncomfortable can actually lead to stronger relationships, better well-being, and longer lives. So, if a man begins experiencing erectile difficulties, the best step is not silence or embarrassment. The best step is curiosity and care for overall health. Talking to a healthcare professional can uncover the true cause and open the door to effective solutions. Because sometimes the issue is not only about intimacy. Sometimes it is the body's quiet message that the heart needs attention too. Your heart works tirelessly every single day, pumping blood through miles of blood vessels to keep every part of your body alive and functioning. When that system stays healthy, energy, vitality, and intimacy all benefit. Taking care of the heart means taking care of the entire body, including sexual health. And that is why understanding the connection between heart problems and erectile dysfunction is so important. It reminds us that our bodies are not separate systems, but parts of a single, complex network. When we listen to the signals our body sends, we gain the chance to protect our health before small problems become serious ones. So, if you or someone you know has ever wondered whether heart problems can cause erectile dysfunction, the answer is clear. Yes, they can be closely connected. But more importantly, recognizing that connection can lead to better health, stronger relationships, and a longer, more vibrant life. Now, here is something important for you watching right now. If this video helped you understand the connection between heart health and erectile dysfunction, make sure you take a moment to support the channel. Like the video, subscribe for more health and relationship insights, and share this with someone who might need this information. Because sometimes the most important health messages are the ones people feel too shy to talk about. And remember this: your body often whispers before it screams. Paying attention to those early whispers can make all the difference for your future health.